Hey everyone, welcome to Blue Bonnet. It's a helpful minute. We have Dr. Jeff Bates here with us today. We're really excited. He's one of our medical directors here at Blue Bonnet Hospice. Also, Mark couldn't make it. I know you'll look forward to seeing him every week, but we have Holly here, who's also one of our owners. It's Mark's wife, so we're really glad to have Holly join us today. And we are at Cordial Health, and so we are not in Waco. We're in Gatesville because this is where Dr. Bates has his practice. And so we want you to get to know our medical directors. It's important to know who is a part of our organization. So Dr. Bates, will you tell us a little bit about yourself and your family, please?
Yes, I am originally from Live Oak, Florida. I drove an ambulance in Live Oak 30 years ago before I went to medical school. I came to Texas 20 years ago to do my residency at Scott & White. I did two residencies, internal medicine and pediatrics. And then I stayed and I did research in their mind-body program for patients with cancer pain. And I was an ER doctor for 10 years, and now I've been a hospitalist for 10 years and a hospice medical director for 10 years. My wife is a nurse, a hospice nurse, who did that for 10 years, and now she's a hospice nurse practitioner for Blue Bonnet. And together, she and I have 8 kids.
Wow, you have a lot of experience with hospice and also a very large family.
Yes.
Yes.
And I've done hospice for many years. I've been with several different companies and had lots of hospice patients. But last year, my father died on hospice, and so I was able to experience it, not just as the doctor and medical director, but also the family member. So I feel like I have a pretty good background in how things work.
That's great, because you have a different perspective for sure when you
Certainly.
experience that. And so you mentioned your experience with hospice, so tell us about your practice that you have here.
Yeah, primarily my job, I have lots of jobs, primarily my job is a hospitalist in Gatesville. So that means if you're in the hospital, your doctor doesn't usually come over from the clinic like they used to do in the years past. So I take care of people in the hospital, and I feel like I can take care of people in the ICU. Anything that you need, I can take care of. But I feel like I'm bilingual, because not only do I speak ICU doctor, I also speak hospice. And so when you want everything done and we're full court press, I get that and I know how to do that. But I also know that you get to a point where you don't want a bunch of tests done. You know you have a terminal illness and you want to be home. You want to live out your days in the best way possible. And so I feel like I speak hospice also. And so I can go either way. And I think one of the things that gets lost in this is that the patient doesn't get to make the decision. They're frequently being told by the doctor, here's what you got to do. You've got to do this test, we got to do this next. And that's not my approach at all. My approach is, here's what's available. If it's not going to help, let's talk about things that would make you more comfortable. Do you need to be on 28 medications? Probably not. But if I could keep you on 3 or 4 medications that would make you feel better, make you live longer, make you do better, then I think that's a reasonable approach, and we should talk about that. And I think that the patient's the one that gets left out, or frequently it's the daughter who wants to have more control of what's going on in the situation, and doctors don't always offer them that.
Yeah, it's important to have the family involved in that too, so that's really important.
I think so.
Yeah, and so you've been with Blue Bonnet Hospice for just over a year, last September, and we're certainly glad to have you.
Right.
What do you think makes Blue Bonnet, what sets Blue Bonnet apart from other hospice agencies?
So I started with hospice. I actually have a master's degree in aging. I forgot about that years ago, and I always was trying to get involved in hospice 20 years ago, and it wasn't until 10 years ago I started with hospice. And I've been through 4 or 5 companies now. And I'll tell you that the thing that makes Blue Bonnet different is Holly Walsh and Mark Walsh. That's the difference, is because the other companies that I was with, the person who owned the company, who ran the company, is a guy in Omaha, Nebraska, a guy in New York City, some guy that has, a high level of accountability, but that is not approachable by me. And so I'm frequently trying to deal with the patient, deal with the daughter, and I want certain things done, and they need a hospital bed or they need a certain procedure done, and I don't have to argue with the guy in New York City. I just say, Holly, this is what needs to be done. We need to get this done, and that's what makes Blue Bonnet different. We're not a huge company, but we're also not such a small company that there's not enough people on call at night to deal with situations. We have, the company that I had been with before had as many as 300 patients, and I think that gets to be too much. But I think if you only have 3 or 5 or 10 patients, that's not enough to be really good at what you're doing. And so I think Blue Bonnet is that perfect sweet spot of just enough patience where we have staff to handle things, but it's still that personal touch. And you know who owns the company, who you can deal with.
I completely agree with that too. So what do you think is one of the biggest misunderstandings about hospice?
Yeah, I think the thing that frequently strikes all of us in the business is that you wait too long. We wait too long for hospice. And the average person on hospice, 1/3 of the patients who go on hospice die within a week. And that's not the nature of hospice, it's the nature of they've waited too long. You know, you knew 3 months ago that this was bad, that you weren't going to do chemo anymore, that you needed certain things. And it's not until the 11th hour that someone contacts us and talks to us. And I think another advantage of Blue Bonnet is that they have a home health. And so maybe you're not ready for hospice, maybe you're on home health, but you have that opportunity where you're interacting with our staff. And so maybe we can help you guide and say, hey, you know, have you ever thought about hospice? Maybe this is the time to start talking about it. Maybe you don't qualify today. The government makes all these regulations about who qualifies. But, you know, maybe it's something that we start the conversation about, because I can see it coming down the road. And instead of them calling the ambulance and you going back to the ER 3 times this week, maybe a better conversation is let's talk about hospice.
I agree. Thank you so much for taking the time. I know you're very busy. You have a lot going on. So thanks so much for talking with our fans out there and kind of clarifying all that. I think it's important people understand hospice and the hospice care that we can provide for them. So thank you, Holly, for coming along today too. And we'll be back next week. Thank you so much.